questions afterwards. And I think that is a great lead in to our next presenter, who is Lieutenant Zach Haish with Pinellas County Sheriff's Office and Safe Harbor Emergency Shelter. And Lieutenant Haish, you can talk a little bit about emergency shelter, which is, of course, part of the coordinated entry system as one of those access points.
Okay, yeah. So, oh good, the PowerPoint came up big enough. I put it together quick and I didn't know how it would look when it came through. So for those of you that don't know, Pinellas Safe Harbor opened up, we're in our 14th year now. And it opened up as a response to the overcrowded situation that the Pinellas County Jail was going through. At the time, prior to Safe Harbor opening up, county jail was crowded, and the unfortunate response, knee-jerk response to homelessness throughout the county was for the homeless population to be arrested on ordinance violations and misdemeanor crimes and things that were sometimes unavoidable because of their housing situation. So the sheriff, the state attorney, and the public defender of Pinellas County got together and they looked at who was going to jail, why were they going to jail, and what was the downfall, and what was the reasons. So when they figured it all out, it was because of a lack of access to other shelters that was happening at 2 o'clock in the morning. That was happening on Sunday or Saturday, because homelessness doesn't happen between Monday through Friday between 8 and 4. And let me make sure that I'm not speaking ill of any of the other homeless shelters in the county. We have great relationships with them, but the whole point of Safe Harbor is that, and you can see on this slide, is that so there is a 24/7, 365 days a year opportunity for homeless adults to get off the street. The sheriff doesn't want law enforcement making arrests on the homeless population when they don't need to. This population needs assistance and services to get back on their feet. So by never closing, Safe Harbor gives law enforcement officers a consistent alternative to incarceration when it's appropriate. I don't know any other, I've been doing this, so I'll tell you about me real quick. I've been a part of the HLA for going on 12 years now. I sit on the Providers Council, and I represent Sheriff Galtieri on the HLA Board of Directors, and I've sat in a couple other committees through the years as well. Through all that, I've worked with other law enforcement agencies, jurisdictions, homeless shelters all throughout the state and actually across the country. I don't know any of the others that are cutting out nearly over $2.5 million a year to operate a shelter out of their law enforcement budget. So it's 2.6 million out of the sheriff's office budget every year to make sure that the homeless population in Pinellas County has a place to lay their head, case management, and food in their belly. And that comes out to about $34 a day. So we want to make sure that those individuals are taken care of. And the individuals that I'm talking about are, you can go to the next slide. The population out at Safe Harbor, we run just shy of 300 on average, anywhere between 250 and 300 per night. We have 400 total beds available throughout the facility. We have about 1,000 individuals walk out of the Pinellas County Jail every year with nowhere else to go. And those are the only ones, those are just the ones that tell us that they spent last night in jail, or they spent the last few nights in jail. Yeah, it's probably a little bit more, but we use the self-disclosed information in HMIS. So on average, there's about 3,500 unique individuals that seek shelter at Safe Harbor every year. I mean, when you look at the PIT count every year, we're seeing more faces than the PIT count sees every year, just at Safe Harbor alone, and that accounts for about 10,000 intakes. We're well aware that homelessness doesn't get solved the first time you access services. It doesn't get solved the first time you access shelter. It doesn't get solved the first time you decide to do anything. So we know it's going to take 5, 6, 7, 8 times sometimes for some people to get things straightened out and to be willing to work with case management. A lot of times it's rapport building, and they've got to come back 3 or 4 times before they feel safe, telling their tale to a stranger. The average age group is 31 to 50, but our rules are 18 and breathing. Basically, anybody that is over the age of 18 and can care for themselves, we're more than willing to let you come in and get off the street and give you an opportunity. You can go to the next one. The facility, we're new intakes are accepted 24/7. Wi-Fi is throughout. Curfew's at 8 o'clock. Curfew. So 8 o'clock at night, we do a physical attendance most nights of every individual in the facility or those that are signed out to work. So we know the population works. We want them to work. So if you're signed out to work, we'll save your bed, we'll save you a plate of food, and we'll make sure you're taken care of. Work or school, or if anything, anything that might be approved. Intakes again are accepted 24/7, but if you're here and you're stably here, we would like you to be back by 8 o'clock at night. You get some breaks on that. We understand that you might have somebody's couch to crash on for a couple of nights, so you might go do that for a couple of nights, and then you're going to come back. We get it, we understand, and we work around those things. Access inside, everybody's got washer, dryer, ironing station, microwaves, TVs, showers, restrooms, lockers we give out. I just heard the announcement. We do lockers every Tuesday night to issue lockers so that you can keep your stuff safe and locked up, and your valuables aren't in danger of disappearing. Go to the next one. Meals, so we have a contract. I know John Paul's on here. We have a fantastic contract with Metropolitan Ministries to provide all of our meals out here. Over 300,000 meals are served out here every year. Breakfast and dinner are hot meals. Lunch is a lunch meat sandwich, bag of chips, and a piece of fruit. The sheriff didn't want anybody to question where their next meal was going to come from. So he wanted to make sure that if we're going to open this place up, we're going to do it. We want people to be around. We don't want anybody having to go out and panhandle and scrounge to where they're going to figure out where they're going to get some food in their belly from. So we make sure we serve 3 meals a day out here, so that the residents that are here, they know they're fed and they don't have to worry about where their next meal is going to come from. The meals are served by resident volunteers. You can stay on there, that's fine. We make sure that anybody who's helping serve meals goes through a food safety training. It was approved by the health department. We make sure that they know what they're doing and they're doing it in a safe manner, and they're supervised by an employee. But we want the residents staying here to feel empowered and remind them sometimes that they are capable of doing a little bit more. Lucky for us, we have the Bayside Clinic right on the same property in the parking lot, basically, of Pinellas Safe Harbor. It is a Monday through Saturday clinic for any homeless adult that doesn't have insurance. They can go in there and sign up for the blue card and get access to Pinellas County indigent healthcare homeless plan. We've also got a social worker from the county that is on duty here 3 days a week that can do it in-house and get them signed up, and then they can go over to the clinic. Once they sign up for that blue card inside the walls of Safe Harbor, they can walk over, and they normally have a doctor's appointment within usually like 7 or 8 days. They've got an appointment set up for them, and then they can get access to the Flamingo card that's available through the Bayside Clinic or through the Healthcare for the Homeless plan. 7 days a week, there's a licensed mental health counselor from Elios that is available on site 7 days a week at Safe Harbor, which is fantastic, because for a long time it was none at all, and then we had one 5 days a week, and then just within the past couple of months we've had access to one out here 7 days a week. We would much rather a licensed clinician do a crisis evaluation rather than somebody from law enforcement. The questions and the approach is much different and a better handled through a licensed mental health counselor. Every Wednesday, except for one, I don't know which one, but at least 3 Wednesdays out of the month, the vaccine clinic through Department of Health is out here to do vaccinations for all the communicable diseases that are available out there that are able to be vaccinated against. So this slide and this keeps getting bigger, which makes me happy. We've got 6 case managers out here. We've got a vacancy right now, but we've got 2 assigned to street outreach, kind of encouraging the population that's out on the street and not taking advantage of the shelters and is in violation of House Bill 1365 by sleeping on public property to come inside, take advantage and access to shelter. We'll connect them not only to Safe Harbor, but to any of the shelters in the area or any of the detox programs, Turning Point. We just got somebody in Operation PAR on Friday. So it's not just Safe Harbor that our street outreach people are connecting them to. But for Safe Harbor, we've got all of these people out here, and it keeps getting bigger. Down at the bottom, you can see we've got a new treatment for individuals experiencing homeless grant that is coming on board as we speak. That's one of the additional licensed mental health counselors that I spoke of. It's going to have 4 intensive case managers, oversight from a director, and then peer support specialist and an administrative assistant to try to keep everything rolling. We do have security out here. I know that's a concern for some people, but it's also a relief for others. It's split. Some people like the security and some people don't, but it seems to be a necessary vital piece of our manpower to try to keep everybody safe out here. We don't discriminate regarding people coming in, whether they're intoxicated or under the influence. So a lot of times we have people that are coming in and not so great moods. So it's nice to have security on site to help handle any situations quickly that may arise. PCSO, community policing deputies, there's one always on in the area or readily available to respond. We offer a bunch of classes at various times. They're not always going, but as they come in and as they're available, or as we have the ability to teach them, we make sure those are all taught. Because if we just had a shelter where people could hang out, not learn anything, it probably wouldn't be as productive as possible as it could be. So we're providing all the referrals in the community just like everybody else does. We work with everybody to do everything that we possibly can. We try to do everything in-house. We try to send people out for as little as possible. Just to try to keep everything in. So the only things that we can't do are the DMV bus, which has become harder and harder to get out here, and the Social Security office. But beyond that, we're pretty self-sufficient and self-sustained out here through all the partners that we have. I see there's a question in the chat about taking pregnant women. As a matter of fact, we have 2 here right now. So that's an easy yes. We will connect them to all the pregnancy resources that are out there in the community to try to get them out of here as fast as possible. This is not the hopeful environment for any pregnant woman that's in the area. So we try to do everything we can to try to transition them safely and appropriately as quickly as possible. Is there another slide? No.
Lieutenant Hayes, there were a couple of other questions in the Q&A box. First of all, is Safe Harbor somewhere that a married couple can shelter together?
I know I have one married couple here right now. I don't have any cohabitation. The living areas are separate, male and female. But yeah, we have married couples here from time to time, and there's actually one here right now.
Wonderful. Thank you very much. There was also a question from fellow COC board member, Ms. Teresa Jones, asking, does Safe Harbor still limit the stays of registered sexual offenders?
Good question. Yes. So we're across the street from Bayside High School, which is within 1,000 feet. And many sexual offenders and predators have that rule. We do allow them to come for up to 48 hours. We can stretch that if we do have a housing opportunity on the backside of it. So if we know somebody can get placed somewhere or whatever, we can stretch that out as we need to. But yeah, they can come during one calendar year, and we get them set up with as much as we can in that short period of time that we're allowed to have them stay.
Thank you. I also had a question about the storage that you mentioned. I am guessing that is available exclusively to people who are staying at Safe Harbor, but can you confirm that?
Yeah, so I should have put that. Yeah. So yeah, we have 8 huge storage containers on the outside of our facility, and it's for the current residents of our facility. But the other thing we do is we hold on to it for 14 days past when somebody exits. So that 14 days easily turns into 20 sometimes because we get busy. So your stuff doesn't get discarded or donated just because you're gone for a little while. We have people regularly call us from inpatient programs. We get somebody into a 30-day program. We don't want them to be worried about their stuff going. They call us from the hospital and say, hey, we're going to be here for a while. We take care. We hold on to their stuff.
Wonderful. Thank you so much. We do have one more minute. Are there any other questions for Lieutenant Haish before we start talking about street outreach? Not seeing any immediately. If you have one, Ms. Chair Beckman, go ahead.
Thank you. I've been kind of multitasking, but listening. I had, is anyone charged to stay at Safe Harbor, like if they have Social Security and, or if they have a job but can't find housing? Is there a limit to how long they can stay, and do you charge them to stay there?
We would never charge, and let's go backwards and then forwards. We would never charge anybody a dime to stay here. That would be nope. We won't say what that would be, but no, we don't charge anybody anything to stay here. With I think I just did the report a couple of weeks ago, and it looked like about 27% of our population was working. And then we probably got about another 30% has income through Social Security, retirement benefits, whatever. We connect them to all the transitional housing opportunities that are available, rooms for rent, room, home share, all of those things. We give people time. We know they might have bills. We understand they got to pay things off. Their length of stay is all determined by case management. We don't have a hard, fast 30, 60, 90 days on things. That doesn't solve anything. So it's all case by case.
Thank you so much. Thank you.
Yep.
Excellent. Thank you so much, Lieutenant Haish. Really appreciate that information. And if you have any other questions for Lieutenant Haish, please go ahead and put those in the Q&A box. Lieutenant Haish, if you see them come through, please feel free to go in and jump in and answer them. And then